$150 million to nursing homes that claim to have been underpaid. The money courtesy of the Cuomo administration. But the I-team discovered much of that cold, hard cash is going to go to facilities with the worst quality of care. Some nursing homes will get a payout even though they've been accused of neglecting patients. Tonight, the I-team's Chris Glorioso investigates.
I wanted Carolyn to be safe.
For Andrew Sempa, the last 3 months have been nothing short of a nursing home nightmare. After his wife Carolyn began suffering from seizures and dementia, Andrew and his stepson had her taken to the Riverside nursing home in Manhattan. While there, Carolyn stopped eating her meals and began drooling food and liquid. Despite nursing home records that say she was not swallowing, Sempa says the staff failed to call an ambulance until he requested one. When Carolyn got to the ER, records show she was severely dehydrated. Her kidneys were shutting down. Sempa says doctors were stunned.
They were incredulous. They couldn't understand how someone in a facility come in that condition.
Where's their humanity?
Citing medical privacy, the Riverside nursing home declined to comment on just how Carolyn Evans was allowed to become so dehydrated. Her husband and son are now considering legal action, but they're also speaking out against $850 million the Cuomo administration has quietly set aside to pay nursing homes that claim they've been underpaid by Medicaid.
Will you be concerned if this nursing home gets a piece of this $850 million settlement?
It'd be outrageous.
The I-team found the Riverside is one of more than 230 nursing homes in line to get a cut of that Medicaid settlement, despite having a 1- or 2-star rating, the lowest ratings the federal government gives out. The facilities include a Suffolk County nursing home where bed sores were so bad a war veteran died of an infection, and a Nassau County facility where a patient froze to death on a sidewalk after being allowed to wander away.
One-star facility, you're one of the worst facilities in the country.
Richard Mollett is an advocate for nursing home patients. He called the $850 million settlement a sweetheart deal for nursing homes because even bad facilities get the cash without any requirement they improve their quality of care.
So why would we be giving them more money? We should be taking away money, but we never do that.
The state health department defended the nursing home payout, saying nothing in this settlement would limit the state's ability to enforce rigorous state and federal standards. Leading Age, a group that represents nonprofit nursing homes, said the settlement money will allow facilities to fund higher quality care.
Having this money be able to go into facilities will allow them to invest into the types of technology and services they need to be able to compete.
As for Carolyn Evans, her family says she's now recovered from dehydration and moved to another nursing home. They've hired a company called Medicaid Advisory Group to protect her rights. That company has already filed a complaint with the health department alleging neglect and malnutrition at the Riverside.
What does it take to get to the point where you are dehydrated in a nursing facility?
Neglect, total neglect. You were left there with no water, no food, no medicine. You were completely ignored.
If people read this in the paper and you were talking about this is how they found a dog had been treated, they would be hunting the owner down.
We asked the health department about that neglect complaint against the Riverside. A spokesman said they do not comment on pending investigations. And although the Riverside also declined comment, medical notes from the facility show staff members were aware Carolyn Evans was having trouble swallowing food and water, and even discussed with her husband the possibility she might need a feeding tube. But her husband says no one ever explained how grave the malnourishment was. Back to you.
All right, Chris, thank you. And more investigations mean more answers. So if you have